a nice case presentation today. This is done by the physician doctor who is very dedicated. I have been with him. I have visited some of his patients in Vavunia, and he's a medical officer working in Vavunia General Hospital in the cardiology department. But out of his working hours, he does palliative care medicine. He was trained in Hyderabad for palliative care medicine, but he's from Vavunia. He studied in Vavunia Tamil Mahavidyalayam, and he went to the Colombo Medical College, earned his MBBS, and he's living in Vavunia, serving his community. Please welcome Dr. Mathurahan Selvarajah for his presentation. Mathurahan, you can share your screen there.
Thank you, sir. Thank you for introducing. I will share my screen.
You have 10 minutes, Mathurahan.
Thank you. So I would like to give a briefing about community-based palliative care and with the case presentation. So we are located in Northern Province, district is Vavunia, and even though our district boundaries in south in Vavunia town and north in Kanagarangulam, we occasionally go out of the boundaries as well. Even we currently having 2 patients out of Vavunia district. One is in Pune, that is situated in Anuradhapura district, and another patient at Mullayavalai, which is in Mullathievu district. So I would like to start with the beginning. The recognizing the need to develop palliative care in Northern Province, that initiative was taken by our provincial health department. And with the initiative, 2 medical officers and 2 nursing officers, including myself, we went to Hyderabad with the support of 2 World Cancer Collaboration, Indo-American Cancer Association and IMHO Canada. And we got our training in Hyderabad under the guidance and teaching of Palliative. That was in September to October 2018 for a period of 6 weeks duration. Then we started our community-based palliative care services in Northern Province with the support of KN and IMHO Canada, and we started from January 2019 onwards with the great support from our PD, Dr. Kediswaran sir and Dr. Surendra Kumar sir, who was our mentor and guide. And our team consists of Mr. Navanidarasan. He is a nursing officer, got the training with me in Hyderabad, and another retired sister Punji Heva, who got local training in palliative care from a OMF surgeon who served in Vavunia district. And initially, 3 of us started to visit the patients upon the referrals. The referrals came from the oncology units, sometimes from the community, sometimes from the other physicians as well. So we call it reaching the unreachable, because the socio-economic standard is different from patient to patient, and in some places they don't have a decent thing to call it as a road. So very difficult to access to the nearest healthcare institutions, and some people didn't even have decent houses. And with the available resources, we started to do the home-based support. That the procedures from simple wound dressing and the bedside care, IV fluids when it necessary, pain control, and with the support of IMHO, we started to offer the air mattresses to the patient who were in need. And also, when there's nobody to spend their terminal period, when the patient and when their relatives are anxious with no support or no moral support at all, we spent with the family and we guided them, or with the training we obtained, we could able to help the patient and their family to have a peaceful and pain-free terminal period. And sometimes we came across miracles as well. As I mentioned, we used to get some referrals from community as well. There's a bedridden patient at this place, can you come and have a look? So we came across a 27-year-old bedridden mother of 2 children with no diagnosis, with large gluteal abscess and large bed sore. And after we guided her to the relevant specialist, she could able to walk in 3 months duration. And this specific case I'm about to share today is a 49-year-old female with breast cancer and multiple metastases, including brain mets. And as it was inoperable from the period of diagnosis, she was under palliative care referred by the oncologist. So you can see a house from, I took this Google Maps to show the distance from the Vavunia District General Hospital to her house. So it shows that there's 17 kilometer and 32 minutes duration according to the Google map, but that is not an easy journey to take. I'll show you the pathway we used to. So this how the road looks.
Video is not visible. My
video is not visible, so I will play that again. Give me a second. Is it visible now?
It's visible now.
This how the road and the the surroundings of the household. So they have to spend at least 5,000 rupees for a two-way journey to come and go back to their house. So that is their weekly income for the whole family. So even though they know that there are no curative options available at the house for the disease, they used to come for the pain medications, and for the other relevant clinic matters, they used to visit to the house. So after we intervened, we went and had a look at the patient, and we started to offer the pain medications by our mobile palliative care team. So this was patient during the first visit. So her main problems were recurrent seizures, pain, reduced consciousness, and also she suffered an aspiration pneumonia at the terminal stage. And another main thing was feeding issues when she started to reduce the consciousness. So for the recurrent seizures, we had to discuss with the neurologist, and we started on some medications, and that helped her significantly. And for the pain, we started on oral morphine, and with the dose of 10 milligram 4-hourly dose, she showed significant reduction in the pain. And that is another thing we wanted to point out here. Before the palliative care training, we were not having much confidence on starting on significant doses of morphine. But after the training and with the field experience, now I would love to say that we have the confidence to start the opioid at the relevant doses and to do a titration till the patient's pain comes under control. And also with the reduced consciousness, they had some issue to feed the patient, so we supported to insert the NG tube, and we gave the training to the family members regarding the feeding issues. And as I mentioned, we were able to control the symptoms significantly, and the patient had a very peaceful and pain-free terminal period. And not only the medications and whatever the procedures we did, we also had frequent counseling sessions with the patient and family. So we clearly explained the disease progression and the situation and the prognosis, and the family and the patient accepted that, and they were willing to continue the home-based training. And we successfully had a very peaceful terminal care, which was home-based, no hospitalization, and the decisions taken when the patient was stable, and the family and the patient involved in the decision not to go for any acute intervention during a terminal illness. And I would like to play the patient's daughter's statement, before concluding the presentation. So this is what motivating us, and I would like to say currently we are running a stable community-based palliative care system. So we are getting referrals through the oncologist and sometimes from the other specialties, and whenever they refer, we used to go and immediately see the patient and register to our clinic, and depend on the severity and their stage, we used to arrange the frequency of the visits. For some patients at the terminal stage, we had to visit even every day or every other day, and I would like to thank my team to support it, and our mainly our coordinator Dr. Surendra sir was helping us a lot, and our PD sir also helping us a lot. And another thing I would like to emphasize here is the monthly clinical discussion meeting. So with the problem-based discussion meetings, we could be able to develop our skills, and we could be able to enhance our knowledge as well. So based on that, I think now we can think about expanding to other regions as well, and we will continue with as much as possible whatever the available resources. Thank you very much.
Thank you, Dr. Mathurahan. That was amazing. I have a question from one of the participants. So please write your questions in the chat so that I can ask the presenters. Since you started in 2018, how many patients roughly, approximately you have reached so far?
We have nearly seen around 110 patients at home care service. That is not, we haven't included the patients we have seen at the hospital-based setup. Only the home care setup itself having 110, but a lot of other patients we have seen in the hospital, and they have spent their terminal period also in the hospital. That should be, I think, more than 20 or something. We haven't included that here.
Excellent. Thank you so much, Dr. Mathurahan. I have been with Mathurahan a few times, and I have visited his place. Sitting in Canada and doing palliative care, we have lots of services available for us. But in Vavunia, what he's shown was a very decent road. I mean, I have traveled with him to the really bad places and the remote places. Thanks again, Dr. Mathurahan.